Hello, my name is Kelly Young, and I'm here to speak with you about my leadership project. My project is titled Examining the Intersection of Climate Change, Violence, Global Health, and Women's Resilience. At its core, it was designed to explore the links between climate change, violence against women and girls, global health, and women's empowerment, and to think about what gender inclusive solutions might actually look like. From the beginning, this was designed to be a stretch project for me. I wanted the opportunity to meet people working in spaces adjacent to my own and to spend time learning more deeply about issues I care a lot about, but that sit outside my day-to-day work. When I designed the project, I was serving as the Deputy Director for Global Strategic Information at University of California, San Francisco's Institute for Global Health Sciences. Our work spans countries all over the world, largely through PEPFAR funding, helping ministries of health and implementing partners better understand the HIV epidemics in their countries and reaching targets, reducing the HIV burden and supporting people living with it. Nearly my entire career has been focused on reducing the global HIV burden. I lived and worked overseas for nearly 10 years and in the US for the past 10 years. But during that time, I could see the government priorities shifting, and I anticipated changes coming to PEPFAR funding. That's what really pushed me to want to learn more about climate change, how it intersects with women's health and violence against women. So many global health issues overlap, and I was, and am still, deeply interested in how climate change will shape our future work. By the time our cohort gathered for liftoff earlier this year, a lot had changed. Funding for my position at IGHS had ended. I had to lay off members of my team. After months of job searching, I was incredibly fortunate to start a new role at UCSF as the Associate Director for Programs, Planning, and Evaluation with the Heller Diller Family Comprehensive Cancer Center. I was hopeful that I could continue working on my project on my own time while starting in this new role. After all, it was a stretched project to begin with, and still is. But week after week went by, and I realized just how much effort starting a new position was taking. I was learning an entirely new donor environment, supporting clinical research instead of implementation science, trying to understand the vast scope and depth of work at the Cancer Center, absorbing truly mind-blowing science, and of course, learning a whole new set of acronyms. I was also building and overseeing a new team and working closely with clinicians and Cancer Center leaders. It took all of my energy and focus. And while I'm incredibly grateful to be welcomed at the Cancer Center, to have this opportunity to learn and work alongside people so deeply committed to finding cures for cancer, I would also be leaving out something important if I didn't name it. This year, I've also been grieving. I'm grieving the loss of the work I've done for my entire career. I miss the global HIV community and the incredible network of people who I worked with to fight the AIDS epidemic. I miss my fluency in the science, the language, and yes, even the acronyms. And I deeply grieve what so many of my friends, colleagues, and former teammates have experienced as funding cuts and job losses rippled through our sector. All of this change has shaken me. It's challenged the confidence I've always had in my work, in our sector, in what's possible when smart and committed people come together to learn, to build, and to fight for a better future. That's why I'm so deeply grateful to the WomenLift program this year. It has made me a more thoughtful and intentional leader. As a cohort and as individuals, we've learned about leadership styles, reflected on our own preferences, and built skills to lead with confidence and purpose, trust, and care. And we've committed to building the next generation of impactful leaders. I haven't given up on my project. I see it as part of my longer-term goals, something I'll return to as my life and work settle down into a more sustainable rhythm. I'm still passionate about climate change, the stress it places on communities, and how that intersects with women's health and violence against women. I still want to engage with people working in this space and continue expanding my knowledge and my network. But this year, I also had to step back to focus on what I could realistically take on while protecting my mental and physical health. And that too has been an important part of my learning. Thank you.